I'm going to briefly talk about the different types of contraception. So I'm not going to go into each of them in too much depth, but I'm going to briefly mention the pros and the cons and a few key features that are worth bearing in mind. So the depot is an injection which is usually given every 12 to 14 weeks. The issue with it is that it can cause some weight gain. That's a very common complaint. And the speed at which fertility returns after stopping the depot is also relatively unpredictable. So it can take up to a year for fertility to return. The pill refers to either the combined oral contraceptive pill, which contains estrogen, or the progesterone-only pill. So the way that the combined oral contraceptive works is that it prevents ovulation. It's good because it's reversible upon stopping the pill, and most of the time it makes periods a bit lighter. The progesterone-only pill works mainly by thickening cervical mucus. However, there are some progesterone pills that can actually affect ovulation as well. And the issue with it is that it needs to be taken at roughly the same time every day. So the older progesterone-only pills had to be taken within a 3-hour window every single day. However, the newer ones have a little bit more flexibility. Patients might sometimes get irregular bleeding soon after starting the progesterone-only pill. The coil refers to either the hormonal coil, so the Mirena, which contains levonorgestrel, or the copper coil. So the hormonal coils last for either 3 or 5 years, and they work by thinning the endometrium, and they generally make periods lighter and less painful. The copper coil lasts 5 or 10 years, and it works by causing sterile inflammation. So it is toxic to the sperm, and it also makes the uterus a hostile environment for a conceptus to implant. The good thing is that it works immediately, and it can also be used as a form of emergency contraception. The implant is a progesterone device that's inserted into the arm, and it usually lasts 3 years, and it works by preventing ovulation. The issue is that it can cause some irregularities with periods, but the good thing is that once it's taken out, fertility is rapidly restored. The patch works in much the same way as the combined oral contraceptive. It's applied to the skin for a period of 3 weeks and then taken off for 1 week. And it's during that 1 week off that you have a withdrawal bleed. The issue is that adherence can be a problem in terms of how the patch actually sticks onto the skin, and some people may have adverse reactions.